Hey everyone, I'm Angela, and I am passionate about breaking the stigma of mental illness among fellow Christians. I am here to help you live a more purposeful life with God and with one another. Don't forget to subscribe to my YouTube channel so that you don't miss out on any of the upcoming videos that I'll be sharing. And if you have a topic that you're interested in, please let me know. So today I'm excited to be interviewing my husband, Mike Howard, about bipolar disorder. Thank you so much for doing this.
Anything for you.
Well, I am pretty persuasive. So I just wanted to start out with just kind of looking back on your life. Hindsight is usually 20/20. And so when did you first start noticing your symptoms and how did they affect your life?
I think first started really noticing them as I'm looking back, or at least how I can tell that they were manifesting was probably in college, where I was really outgoing. I would go seek out people. We had a mail room, and I would walk into the mail room just to see who was there, just to see if there was anyone I could talk to. And, just kind of came to be known as being a happy, fun...
a social butterfly.
A social person, right. And then just kind of out of the blue, I would just feel like, I'm done. I want to just disappear in my room for days. I would get up, I would go to class, and then I would go straight back to my room, and I wouldn't come out. And there was just there was a lot of that where I would cycle, and people would come up to me and say, we're worried about you. You just seem, you seem different. You're just worried. What's going on? I'd be like, nothing's going on. Sometimes I don't feel like being out, And at that point too, I started having a lot of problems with anger management, where I would, I'd be frustrated or something would get to me, and I didn't have a healthy coping mechanism at that point. And so that stuff would just get kind of stuffed down, and then there would be something that knocked it all loose, and it would come out, and I took it out on doors and walls, and it was just looking back on it now, I can definitely see that's when the pattern started, and it affected everything from social life to spiritual life to my education, certainly my relationships with everybody. That's the gist of it. That's.
So this kind of continued on into your 20s, and I'll just share this part, is that we just started trying to figure out what was going on. The depression was so debilitating, and so we went to doctor after doctor and tried so many different medications, and they misdiagnosed him with major depressive disorder, and none of those medications were helpful, because in the end what you have is bipolar 2 disorder. So basically,
I'm sorry to jump in, but that was the, it's a trial and error process, because diagnosing mental health just is not an exact science. Well, you seem to exhibit these symptoms, let's throw this at it and see what happens. Now, I was diagnosed with ADHD when I was in second grade and was on Ritalin for a while, and that definitely had an effect. You can see in my grades, and we do have my old report card, so we can
that's the proof.
Objectively verify this, where my grades climbed significantly when I was on the medication, and I went off of the medication around 7th grade, and they just basically took a nosedive. You can tell where I started having trouble again with concentration, with follow through, details, and that sort of thing. Right. And after they treated this as in my 20s as first being, a clinical depression disorder, one doctor decided, we kept having to switch doctors because our insurance would keep changing. And so it was like, oh, great, we get to start over with someone else. And they finally threw a medication called Depakote, which is it's a standard it's a mood stabilizer. And we knew that one was kind of it when I just stopped feeling
It was not it,
anything.
Maybe.
Well, I'm sorry. It was bipolar. I think that kind of verified, okay, we're dealing with something deeper than ADD, because it cut off highs, and I didn't always go very high, but however high, it just cut that off. It cut off the lows, and I was kind of a zombie. It was just like, cognitively things registered with me. Oh, that's funny.
But you didn't.
But there was no outward reaction to it. So it was like everything was still okay up here, but it wasn't, everything here. And that's pretty normal to have something that's just not a good fit. Some people it'll fit great for, some people not.
So I think the encouragement for someone who might have just been diagnosed with bipolar disorder is that it is a trial and error as far as medications, and don't give up on that process. So what would you say to someone who has just been recently diagnosed with bipolar 1 or bipolar 2?
The best advice I can give is that you have to own it. This is for better or for worse. You didn't do anything to deserve it. You didn't do anything to get it, but you do have it. And you can't, throw blame around it. It has to be your problem. So that means you have to educate yourself. You have to sometimes take initiative, especially if luckily for me, my wife had educated herself, and she was, it was all starting to make sense to her. So she was a great advocate for me in pushing me forward and saying, you need to get help. You need to get help. There's something not right here. And so that's an important part, is to try and find that support system. If that's probably the hardest part, but owning it, I think, and taking that initiative to educate yourself about what's going on. The second thing I would say is that you really have to be honest with yourself, and you have to be able to say, okay, I'm looking back, and there's definitely a pattern here that's not normal, and you can't try to justify it or say, well, I was having a bad time, or maybe you were having a bad time, but your reactions to that weren't exactly
in line or
right.
appropriate.
They weren't. I remember coming into work, and someone would meet me, as I was getting to my desk, and be like, we have this problem. We need to solve it now. Oh my gosh. And I'd be like, okay, let's do this. Let's get this done. And I was perfectly fine. And the next day I could come in with the exact same scenario. Someone could come up and, oh my God, we have this problem. And I would fly off the handle. And it was just, it's a not knowing who shows up. Is it going to be calm, rational Mike, or is it going to be, out of control, borderline Hulk Mike,
I think that really speaks to the fact that if you're experiencing these symptoms, that your normal response or your baseline response to social situations or stressful situations is authentic. That is who you are. And when you respond in a way that isn't in line with your ethics or your values or how you want to be, that is the disorder, and you need to really, like he said, own that and be responsible for that, because you can't blame anyone else for that. But you can do things to make it different by taking the medication, by going and seeking counseling, by getting that social support and spiritual support from people like your pastors or other support systems that you can gather around yourself. Because
that's a
that's
good
a big
segue
part.
into the third part that I would tell someone, and that is, in addition to being honest with yourself, you need to find someone that you trust and that you can give license to say to you, you're not right. Something's going on here. Mm-hmm. Your behavior has been different or out of control, and you have to listen to them. You have to trust them, because you don't always perceive things the right way, because there's just something in your brain that is off balance, and it throws your perceptions off, and that's part of the disease. So if you have someone who can say to you, you're out of control, you're in a tailspin, something's going on, you got to make some changes.
Right.
That's a really valuable resource, especially if you can then say, okay, I trust you, and I'm going to do.
Right. There's a humility in that, yes. I think, and a huge part of being able to accept that sort of advice is accepting the disease itself.
Right. Not just a humility, but a surrendering.
Right.
And saying, well, not surrendering, but a acceptance and saying, okay, I have a problem. I need an accountability partner, basically.
Right.
Just someone that's going to say, okay, you're out of whack here.
Somebody who's going to be real with you, but not in a condescending way.
Right. I mean, and you have to find that relationship that works. How best can you tell me? Because we tried different things, from the getting in the face and be like, yeah, you're out of control, blah blah blah, and I don't, I wouldn't receive that very well, and so I would be resistant.
Who would receive that well?
And over time, it's come to an honesty, being honest, but not treading on eggshells kind of honest, where it's like,
yeah,
you are a little tiny, she can be frank with me and just say,
right,
you're not right, something's wrong with you, we need to maybe take steps to change.
Right.
Maybe change a routine or change.
Right. Or like maybe there's been a lot of stress lately, so you need to have a little bit of buffer in how much downtime that you have or something like that. And I think it's really important to be sensitive to those things and know what is going to help your loved one either come out of a depression or come down from a mania. And sometimes that's really serious, and that's hospitalization, and that's a different medication or an intervention that's really serious. But sometimes it's just, okay, you know what, we're canceling everything for this weekend, and this is what I need right now. And so just that frank honesty is super important.
Capacity planning kind of thing.
Right.
And then the fourth thing I would say is, there's hope. There is absolute hope. It is not a death sentence. It's not, you're not going to end up on the street muttering to yourself. It's not that kind of, disorder. There is definite treatment options for it. Mm-hmm. I mean, I think you would be surprised to know how many people are out there who function very well and who have some kind of mental disorder. Be it they're depressed, or there's bipolar, or there's ADD, or there's some other some kind of social anxiety, generalized social anxiety disorder. And so it's not insurmountable. It's just it's going to require a change in tactic and strategy, but that's you have to adapt and overcome. I guess is the best way to put it.
That's good. I think that I would really say to someone, if you have a loved one who's has this diagnosis, that it really is a huge responsibility for you to educate yourself, because there's just no excuse for not doing that. There's so many resources out there, and you're going to be at your best for your spouse or other loved one if you can really understand and have the empathy that you need in order to be that support system. So how have you experienced the stigma? Because we talk a lot about that with this disorder in your life.
Yeah.
The
only really bright, shining example that I can think of is I was... this is probably right around the time I was first diagnosed, and I was working with the youth group at our church, and we were in our staff meeting, and we were doing prayer requests, and I said, I'm just really feeling down. I'm feeling really depressed lately, and it's, I don't know why. It's not like, it's not like there's anything going on. It's just, I feel depressed, and I don't want to be in that place. I need prayer. And afterwards, one of the other youth leaders comes up to me and says, if you're depressed, I really question whether you have a relationship with Jesus, because Christians should never be depressed. And I mean, that just highlighted how people don't get it, that it's a physical disorder. It's not, and it manifests itself in the worst way, of course, with behavior and with that kind of, outward symptoms. It's not like someone with, high cholesterol or diabetes or something where it's not visible. When you have a mental illness, that's how it manifests itself, is in your thinking and in your behavior and in your emotion and all of that. Right. And so I think it's hard for people who don't deal with that to get it, because there's no shared experience. There's no shared, they haven't experienced it, and there's no, empathy can only take you so far, where you're like, well, that must be terrible, but there's just no real way to identify with it. Beyond that, the people I've told have been understanding, if not, even if they don't quite fully get it. I've shared it with my bosses, both my bosses at work, and with other guys I work with. I'm pretty open about it. I'll tell people about it, and the worst of it is they'll just be like, "Oh."
Yeah.
And shrug it off, and
as if it's no big deal.
Right. And then the best of them are like, "Oh my gosh, that must be terrible," and every now and again, if they notice things are, wrong, they'll be like, "Are you doing okay? How's things going? How are you doing?" They'll dance around it a little bit. They don't want to be like, "So, how's the going?" You know what I mean? And
yeah.
They'll just, lucky for me, I just haven't experienced the whole.
It hasn't been to the extreme. I think for me personally, I feel like when we do share, and we will say things like in a Bible study group, or we'll just be open with friends, I feel like the silence is deafening, is that people don't know what to say, and so then they say nothing, and then you just feel more alone than you already did. And so I experience it in a different way, I'm sure, just because I'm not the person with the illness, but I have, it affects me every day. And so I think that people are just like, well, it'll be okay, and it's just sort of like a pat answer, or they're just like, oh, and so you feel a little bit isolated. And then I feel like I can probably never explain my life very well, because there are a lot of things that I have to adjust because of being considerate of the illness and how we want to plan things. And so I think that whatever it is that you're experiencing as far as the stigma, it's normal to come against these. But again, the best thing you can do is to educate yourself, and to try to educate those around you as you discover more things about how it personally affects you, because everybody's different. So you can't always change people's minds if they have this mindset like that person did, saying that you're not a Christian if you're depressed, which is completely false. So it's not like we have to be on a mission to change people's mind, but just for us to know ourselves what's true and what's right, and not be confused when we do hear things that are inaccurate. And so we just have to endeavor to live an authentic life, and remember that we are created by God, and He didn't make a mistake when He made us. And I love what it says in 1 Corinthians 2:16, who can know the Lord's thoughts? Who knows enough to teach Him? But we understand these things, for we have the mind of Christ. And so that's true for you, whether you're struggling with a mental illness or not. And so we do have the mind of Christ regardless of what's going on, and we can stand on that and believe that. And so if you have any further questions for Mike or I would love for you to comment, and we can get back to you about that. We'd love to hear from you. And just remember, please subscribe to my YouTube video so that you don't miss out on any of the upcoming videos that are put up. We're just really excited to share things for whatever it is that you're facing, whether you have a mental illness or have a loved one who does. I'll see you next time.